Jane Cooke Wright, Black physician. Jane Cooke Wright has carried on the medical legacy of her prominent family through a career in internal medicine, cancer research, and medical education. She has served as director of the Cancer Research Foundation of Harlem Hospital in New York City, faculty member and director of cancer chemotherapy at the New York University Medical Center, and professor of surgery and associate dean of New York Medical College and its affiliate hospitals. Wright has also devoted her efforts to educating fellow practitioners about advances in chemotherapy, a service she performed in her 1983 convention lecture to the National Medical Association entitled Cancer Chemotherapy Past, Present, and Future. Wright was born in New York City on November 20th, 1919, to Louis Tompkins and Corinne Cooke Wright. Her paternal grandfather was one of the first graduates of Tennessee's Meharry Medical College, an institution founded to give former slaves professional training. Another relative, Harold D. West, was Meharry's first black president. Her step-grandfather, William Penn, was the first black person to earn a medical degree from Yale. Her father, Louis Tompkins Wright, one of the first black graduates of Harvard Medical College, was the first black physician to be appointed to the staff of a New York City hospital. He was also a pioneer in cancer chemotherapy and New York City's first black police surgeon. Jane Cooke Wright was the first of two daughters. Her sister Barbara also became a physician. Wright was educated in private elementary and secondary schools and won a 4-year scholarship to Smith College in Massachusetts, where she set records as a varsity swimmer. Graduating in 1942, Wright entered New York Medical College, again on a 4-year scholarship, and received her medical degree with honors in 1945. An internship and assistant residency followed at Bellevue Hospital in New York City. After leaving Bellevue Hospital, she completed her training with a 2-year residency in internal medicine at Harlem Hospital. Wright's first position after residency was as a school and visiting physician at Harlem Hospital in 1949. She became a clinician later that year at the hospital's Cancer Foundation, which was then headed by her father. There, she studied the response of tumors and growths to drugs and the application of chemotherapy in the treatment of cancer. She explored the complex relationships and variations between test animal and patient tissue sample and patient. She explored the complex relationship between test animal and patient, tissue sample and patient, and individual patient responses to various chemotherapeutic agents. Upon her father's death in 1952, she became the Cancer Foundation's director. In 1955, Wright joined the New York University Medical Center to direct the Cancer Chemotherapy Research Department and teach research surgery. Her continuing research explored animal and human responses to chemotherapeutic agents, and isolation perfusion and regional perfusion chemotherapy techniques. In 1961, Wright became adjunct professor of research surgery at the medical center and also served as vice president of the African Research Foundation, a position which took her on a medical mission to East Africa. In 1964, she was appointed to the President's Commission on Heart Disease, Cancer, and Stroke. The commission's work resulted in a nationwide network of treatment centers for these diseases. The Albert Einstein College of Medicine presented Wright with its Spirit of Achievement Award in 1965. Wright became Associate Dean and Professor of Surgery at New York Medical College in 1967, where she was also responsible for administrating the medical school and developing a program for the study of cancer, heart disease, and stroke. She was awarded the Hadassah Myrtle Wreath in 1967 and the Smith College Medal in 1968. In December of 1975, Wright was one of 8 scientists saluted by Cancer Research in its observation of International Women's Year, and in 1980 was featured on an exceptional Black Scientist poster by Seba Girgi. Since 1987, she has been Emerita Professor of Surgery at New York Medical College. Wright has served on the editorial board of the Journal of the National Medical Association and as a trustee of Smith College and of the New York City division of the American Cancer Association. She married David D. Jones, Jr., a graduate of Harvard Law School, and on July 27, 1947, the couple had 2 daughters, Jane and Allison. Her hobbies include sailing, painting, and reading mystery novels. Citations are in the description.